So after 4.5 years of MBBS, 1 year of internship, one more year for preparing for NEET PG, and many months of wait after the NEET PG results, the counselling finally began in July end. And after some more wait in this process and some more hammering, I have finally secured my desired branch in my desired college. Hey friends, welcome back to the channel. This is Dr. Nikhil Bharad here. I've secured an All India rank of 2011 in the NEET PG 2023 exam. And well, today is more of a life update video. So the results for my NEET PG exam had come out in March this year. Basically, after the NEET PG exam for admission to medical postgraduate courses, there is a counselling held for admission, in which we put all our desired choices in order and they are allotted to us on the basis of merit and a few other factors. Ideally, this counselling process should begin soon after the announcement of results, but due to many factors, this time also it was delayed. So now I had this question of what to do in this gap between the results and the counselling to begin. So in this gap, what I did was I gave some thought and did some research about what branch I want to take and what college I want to take. And of course, also in this gap, I started this YouTube channel. So the first question that naturally comes to the minds of most people who have cleared NEET PG is what branch do I want to take next? So for me, after internship, one thing was clear that I was more interested in a surgical branch than a medical branch. I was more into the surgical aspect of things in which I could simply just cut out the defective part and send the patient home happy. As opposed to the medical side where I feel that you just keep giving medicines and you can't see the effect directly and there's a lot of side effects too. Well, that was just not the thing for me. So with that clarity in mind, a lot of branches like medicine and pediatrics were already excluded from my choices. Apart from that, I also thought of the other subjects, but I couldn't find any interest in them. I wasn't very interested in ENT, and ophthalmology and orthopedics didn't particularly interest me a lot. Also in this period, I visited some private practitioners in my area, pediatricians, radiologists, and saw how they work. And after this, one more thing became clear to me that I was more interested in the treatment aspect than the diagnostic aspect. So that way, radiology became slightly out for me because in radiology, you mostly diagnose the patients and what illness they have. And I felt that I didn't want to just stop there. So I could not just simply stop at diagnosing. I was always thinking one step ahead of how to treat the patient, how to make the patient better. And I found that I couldn't do that in radiology. So radiology became a little bit of a lesser preference for me. So in the end, after all of this research, I had narrowed down my specialties of interest into either surgery or OBGYN or radiology being the last among them. So on the basis of this, I did a little more research and I discovered that I was more likely to get into one of the Mumbai colleges for these branches at my rank. And frankly, I wanted that only because I had done my UG from Mumbai itself, so it was more familiar of a place to me. So that was more preferable for me. So a couple of months back, I went to Mumbai to check the colleges there and how the scene is, and a few of my seniors were already there in the colleges, so that helped out. Plus, I also met some of my friends and I also took interviews of 3 of my friends, which are up on the channel already. Anyway, over time I discovered even more that radiology was not exactly the right fit for me because I was more interested in treating than in just diagnosing. Now, even in radiology, there's the domain of interventional radiology where you can also treat, and radiologists also do a lot of diagnostic as well as treatment procedures as well. But that aspect was a little less, and so I wasn't very interested in it. So finally, as the counselling approached near, my choice started becoming a little more clear, and I decided to pursue obstetrics and gynecology. I found this branch to be very interesting and rewarding. It was also a healthy mix of surgery as well as medicine, so I could get a taste of both of those things. Plus, the satisfaction of making couples happy after delivering their babies was something different I felt. And also, one additional thing that I thought helps me in this regard is that this is more of an end branch. That is, there is no super specialty in obstetrics and gynecology. So, on the basis of all of these factors, I finalized my branch that was going to be OBGYN. And fortunately, at my rank, my chance of getting into a Mumbai college was extremely high. So that was another sense of relief for me. I inquired a little bit more and obtained the rankings of colleges for OBGYN in Mumbai as well as outside. And with that knowledge, I entered into the counselling process. Now in the first round of All India counselling, I got allotted a college, but that was not a college that I desired. So I took a free exit in the first round and went for the state first round. And in the state first round, I finally got the college that I desired. So I finally ended up getting MS OBGYN at St. GS Medical College and KM Hospital, Mumbai. And well, after seeing the result of the first round of the state counselling, it was such a sigh of relief. The uncertainty was finally over for me and finally I could relax in a little bit of peace. And this was a very long journey indeed, and I'm really grateful for all those who supported me all throughout this. The first mention in the list of my supporters, of course, will be my parents, who helped me and supported me a lot during the whole of the preparation phase, which was really long and really tedious, and also all throughout the counselling. The next big thanks goes out to all of the teachers, which in my case was the DAMS faculty primarily because I followed notes of DAMS. Their teaching was really superb, their notes were really amazing, they helped clear all the concepts very easily and provided all info in a concise manner, and DAM's notes had a huge part to play in all the success I had. Next, I'd like to express my gratitude to all my seniors who helped me out during the counseling process. And this list would be incomplete without mentioning all of my friends who have been with me all throughout MBBS as well as during the preparation phase. And a huge thanks to all of you guys and all those who chose to subscribe to the channel and give me this opportunity to speak out about my experiences here. If you have chosen to subscribe to the channel and if you have come this far in the video, then thank you so much, this means a lot to me. And this is probably the last video from this safe haven that is my home and my room. But hopefully this is not the last video. I hope to continue sharing my experiences in residency as well. If you guys found this interesting and want to join me on my journey, then please consider subscribing to this channel, it would mean a lot to me. For all of those who haven't yet secured a seat in counseling process yet, all the very best to you. I hope that you get a seat of your choice. And if you're a NEET PG aspirant currently preparing, then all the very best my friend. I hope to see you on the other side soon. So I guess that's it for this video, and I will see you in the next one as a resident doctor. Bye bye.